Previously, you remember, without the prior to the borderline regression method, we used to have a checklist score. So a student's performance was observed by the supervisor. The OSCE would have an encounter of the patient, SP, and the supervisor. So three different persons will interact to do an OSCE, and the supervisor will just be observing unless there's an instruction for him to interact with the students. Otherwise, he will just be observing. So the global rating is something, checklist is, he has not designed the checklist, is already there. So if somebody is performing according to the checklist, he will just assign the marks which is there in the next column, say 1 or half or 0 marks for not doing that step. But when it comes to the global rating, when an observer is observing through the checklist score, at the same time, he is also observing the student's performance as a whole. For example, is he taking a seat properly? I have seen the students, seat is given to them to sit in, and SP is sitting in front, and they are roaming all around. They are running from left to right to pick up the instruments and all. They are very messy in that. So this one, and then how they treat the patient also. They are treating the SP as a kind of mannequin or something. Patient care is not provided and all. So there is an assessment, overall assessment of the assessor on the overall performance of the students. Is he a safe? Is good to be sent to the community? And he is doing all the other everything which is good enough to give him an overall feeling which has everything in it. But then you score them in terms of global rating, which is usually in 3 to 5 rubrics. For
Right.
example, excellent,
Yeah.
excellent performance 5, good will be 4, then poor, borderline would be pass would be marks 3, borderline is 2, and fail is 1. Now, coming with this rubric, I'm moving on to your next question, which is about the borderline students. That's a very good question also, because borderline is in a standard setting is an important thing to be agreed upon by all the judges involved in a standard setting. If they have not agreed to the borderline student definition, there will be haywire. The rating would not be that, consensus can be achieved by an average, but somebody may have given out of 140, another 80, because they have not agreed upon on a definition of the borderline. But then the question is, often the borderline is considered the borderline failing student towards fail, right? For example, 50%, I'm just giving you a magic number of 50. So something 49.5 would be borderline. I think any borderline shouldn't be borderline fail or borderline just pass. In medical education, it's time to move from borderline, though they are borderline, the minimal competency must still be achieved by the borderline student. So a borderline student definition will be with the minimal competency, not with in term of numeric, 49 or 50 is passed, so 49, 48 will be borderline. No, minimal competency that a student should have should be the borderline student. So a minimal pass a student, rather, I would say. Many center would go for borderline fail students as the close to the borderline fail student as the borderline definition. So borderline definition, over the years I have practiced and I have come to the conclusion that it should be the minimal competency achieved by a student should be the borderline students. Okay. I hope I have cleared your questions.
Thank you, Dr. Shad, for
and
the
Naveed is also here. Naveed is an excellent speaker, and his work in the standard setting. Yeah.
Raise your hand who have the question so we can.
Yeah, so Naveed can also give a rejoinder if he wants to on borderline definition and all, because he has done a lot in the standard setting.
Thank you so much, Dr. Shahid. I completely agree with you. The definition of borderline is very important. And I think when we go through the literature, the definition will vary. Yes, Tabassum.
Yeah, I think there's a question in the chat box related to assessment of the soft skills. The question asks, are there any tools to assess soft skills which are particularly related to undergraduates and in workplace-based assessment for the postgraduates? Assessment of soft skills.
There are various tools which are being developed and investigated for their validity and reliability in different contexts. For example, there are certain inventories who would assess leadership skills, self-reported leadership, or teamwork, or a 360-degree assessment of teamwork. I also know that there is a tool by the Royal College of Canada to measure health advocacy. One of my master students is adapting that tool for the context of Pakistan and is trying to validate. So yes, you will find different tools in different contexts and regions which probably work for them. It is relatively new. There are certain tools which are well established. So go through a literature review, find either ones which come from very similar contexts as yours, and please try and do a pilot study or a validation study first, edit them, revise them as needed, and then use them. Thank you. Dr. Shahid, if you may want to add.
Okay, thank you, Naveen. Very nicely given the tools for this, the soft skill. 360-degree should be the one. You shouldn't rely on one, factor or the other. A 360-degree would be a nice rule. For example, feedback may come from the nurses, from the doctor, from the peer, from even the admin staff, right? They all should give feedback and professionalism. But there's a one irony to the professionalism during COVID. I observed that, for example, in my institution, professionalism is you must be satisfactory on professionalism aspect, attitude, and all, to take the professional exam, right? But when it went to the exam, online exam during COVID, I saw a lot of investment was done by my institution by putting cameras on the students, watching them for cheating. Now, these are the students who have been fulfilled the criteria of our professionalism, and only that was the prerequisite to take the professional exam. But why these many cameras? Meaning that professionalism that we have declared them satisfactory, yet we are not trusting them in exam, and we are suspecting them for cheating, and we are putting on so many cameras and so many investment done on this proctoring the students. So this is something contradictory in practice, and this should be overcome. So for the sake of one or two students expected to be cheating, the entire cohort, the class shouldn't be made hostages in assessment by putting cameras and having distrust on their being honest or professional. So something which, if they have a 360-degree assessment on professional, and the other thing about the soft skill is it shouldn't be confined to year 1, 2, or 3. It should be embedded throughout the curriculum. So start from semester 1 until semester 10, or year 1 to year 5 or 6. So it should be embedded throughout the curriculum delivery.
Thank you for the elaborative response. If there are no further questions, then I guess we'll go towards conclusion of the session. Just let me check in the chat box if there are any. No, I don't think so. There are any questions in the chat box either. You can have responses in the chat box related to the same question, and for further research and discussion in this area. So with this, we thank all the presenters. It has been a wonderful day of learning for all of us. We have gathered a lot of cognitive awareness and understanding of different concepts and different areas, basically in the field of health professions education, commonly known as medical education. On behalf of SIVU, the and the team of SIVU and the medical education and the department, Dean Medical Education and Dean Kerbala Medical University, the Vice Dean Medical University, and all the team of College of Medicine, Kerbala University. We thank all the audience, the participants who have joined us from across the world, wherever you are in the evening, morning, in the afternoon. So it has been a wonderful day. Thank you for giving us time, being patient and listening, and of course, asking very, thoughtful questions. So we would like especially to thank Professor Shabir Zedi, the Vice Chancellor of SIVU, for his thoughtful, this is his basically idea of arranging all these kind of activities. And this has been a wonderful experience for us and a wonderful learning point one day for us. So Dr. Hilal Safar from Baghdad, we thank you for his presentation. Dr. Ali Tarek, a wonderful presentation on concepts in the medical education curriculum. We thank Dr. Professor Sholeh Bigdali for her presentation, which will be uploaded on the website on gamification in medical education. Mr. Hassan Zafar, a wonderful presentation on blended learning. It has been, I really like, the digital Bloom's taxonomy that you presented. And Dr. Gohar Wajid, his presentation on the accreditation process of medical colleges and his experiences. Dr. Muhammad Tariq on presenting a very thoughtful presentation of clinical diagnostic reasoning and the various ways and methods of going through the diagnostic reasoning. So I think this would help in deciding and going through the going to make a diagnosis. Professor Karim Kayumi, we would like to thank him in absentia. He's in Canada, so he was not able to be present in person, virtually to present. But his presentation will be uploaded on the website, and his title was on cyber patient. Dr. Shahid Hassan, a wonderful presentation on psychometrics, very heavy concept, very nicely presented. Thank you so much. And Dr. Naveed Yusuf, thank you so much for presenting a very, concise and very easy way of understanding excellence in student assessment, whether it is a journey or a destination. So with this, we thank all the presenters and all the organizers on behalf of Kerbala Medical College University and SIVU. Thank you so much, and over to you, Dr. Abu Tayyib.
Thank you, Dr. Tabassum, for moderating this session. Dr. Shabir, you have, Dr. Shabir, go on.
No, I just I'd like to thank Rad Umran, the Dean of Kufa University, is coming over in a meeting. I'd like to thank him officially for giving the opportunity for organizing it with, of course, the help of Dean Zubaydi and yourself. Rad is busy right now, but I just want him to say a few words. Rad Umran is the Dean of Kufa University, and we're grateful to you, sir, for giving the opportunity. And of course, Tabassum has thanked everybody without mentioning or missing out any of the names. I mean, it's been a wonderful exercise. Ali Abu Tayyib, you are a master crafter. You've done well. You've done wonderful. So,
thank you.
Is he coming?
Yes.
What I'd like to say, God Wajid has given food for thought, and we should learn from him, and accreditation process tends to start. So, for example, Hilal talked about it. We can initiate that activity and probably look into it. Because the purpose of a conference, and as God said in one of the meetings, there should be a theme, an objective. It's not just to come, gossip, and go away. There should be an objective, and I'd like God to comment on that. Professor Gaur Wajid, are you there? I can see you. Anyway, come in. The other thing I'd like to
your
say
voice is not clear.
Oh, well, that's a pity. It's just old voice. So the other thing is that I'd like somebody to announce the program for the next 2 days. Tabassum Ali Abdul, can you announce while we wait for Radumran? Ali Abdul,
Yeah.
tomorrow.
Thank you, Dr. Shabir. Thank you all. By tomorrow we have tomorrow and after we'll have 2 workshops. By tomorrow we have workshop on medical education, different topics regarding OSCE and clinical examination, clinical assessment with Dr. Shahzad Anwar and Dr. Mulazim, who already landed that they're supposed to be with us here in Kerbala by today, but their flight is delayed. And Dr. Tabassum will be also with us by tomorrow, and we have online speakers from over the seas, from Pakistan also. By Thursday, we'll have another workshop, but it's in person, not online also, which is will be Dr. Fatima Jawad from Pakistan, who also her flight had delayed. We don't know what's the problem with the planes these days at the airport. Also we have Dr. Mulazim Bukhari on Thursday. We hope, and Dr. Shabih also hope we will see you will be with us here in Kerbala, inshallah. We'll have a wonderful, inshallah, workshops and fruitful. Thanks all for this wonderful webinar. Thanks for Dr. Shabih and for SIVU and all speakers, and for colleague Dr. Tabassum for moderating the session with me. I do not forget anybody, even thanks who cannot attend. Thanks to all presenters for wonderful ads and questions and discussion that add a lot to the webinar. Instead of Dean Zubaydi, who's busy right now, he thank you all, and hope to keep in contact in further other webinars online or in presence, inshallah. Thank you for us as SIVU to hold these series of webinars and activities. If no any speech, I think we reached to the end. We will have some. You can send any suggestion. We'll have some conclusion by the end of these 3 days to finish. Yes, Dr.
Yeah, I think we would like to thank Dr. Mubashir, who has especially been a very supportive and handful hand during this webinar session. Thank you. Thank you.
Tabassum, I can see somebody raising hand.
Yes.
Please unmute your mic.
Wait for a minute. Can you wait for a minute? Like Radumran wanted to say everything. Just a moment, maybe a minute or so. He's in a meeting right now. Radumran is our host today in Kufa. I just wanted to. In the meantime,
Fatima Dabaqi, you raise your hand. Do you have any comments?
About accretion.
Or it's by mistake? Dr. Fatima, yes, just unmute yourself. Dr. Fatima, unmute yourself and speak, please. You can unmute yourself. We do not hear you. Would you unmute yourself and speak?
I think she's talking, but she forgot to unmute.
Okay.
Yes, now we hear you. Yes, now we hear you. Go on. Dr. Fatima, we hear you now.
Yes. Yes. Hi, everyone. My dear faculty member, and I want one ask from the physicians. In here, all the physicians interested in to diagnose with technology, not with physical exam or given any story of the disease. What is your opinion for this?
I think this question is particularly related to Dr. Tariq's presentation.
Yes. Yes.
I am not sure whether he is still connected.
Dr. Tariq, are you there?
He was a few minutes ago. He was connected. I think
Yes.
he left. So anyone
May
who
I?
could, yeah, Dr. Tariq.
Thank you, Dr. Fatima, for your important point. This is what highlighted by Dr. Tariq. You are definitely right. Now there is a shift towards investigation and electronic, and rather on focusing on history and examination.
Kufa University to say a few words.
Okay, just so it's important notes. We need to keep the professional attitude of junior physicians to that history. Clinical examination is the base of clinical work, and we not rely on investigation and electronic and other helpful instruments rather than history and counseling the patient who do not focusing the psychological support of even just speaking with the physician and the professional relationship between and trust between physician and patient. Thank you. It's very important note. Now talk to Dr. Ra'ed Umran, Dean of Kufa College of Medicine, University of Kufa. Most welcome, Dr. Ra'ed.
Thank you so very much, Dr. Ali Abu Tahin. I want to thank the organizing committee and the head of the university, the president of the University of Kerbala, Dean College of Medicine, Kerbala, the head of the organizing committee, scientific committee, especially Dr. Ali Abu Tahin for the nice organization, very valued topics choose for the present, very nice presentations, all presenters and professors who speak today. There's a lot of information. We learned a lot of from them today. So thank you so very much. And I hope the success for the coming 2 days in the workshops. And inshallah, maybe we can attain one or two of them. Thank you so very much, Dr. Ali Abu Tahin. Thank you.
Thank you very much, Dr. Ra'ed. Thank you for support and help and great effort to the next person on your right hand, Dr. Shabir, who all manage and mentor us and lead us in these activities. Thank you to all. I think if no other comment and question, we reach to the end of the webinar and symposium for today. Any feedback will be you can send it to us and will be helpful. And see you in others webinar, inshallah. Thank you. Thanks to all. Goodbye.
Thank you.
Thank you too so much.
Bye-bye.
Goodbye.
Very nice. Very nice.
Yeah, good.
I missed a lot. I missed a lot.
We had meetings with them.
ضحك